Hello everybody. Today I'm going to talk about the importance of seeing a patient as a whole from all the possibilities. Sometimes when we see patients who come with depressive features or anxiety or palpitation, lack of sleep, and even psychotic problems, we think that primarily it is a psychiatric problem. But something may be wrong in the body as well. Why is it so? Let's take this example. Few months ago, I saw a patient of 40 years old female who was completely normal 2 weeks ago. And for the last 2 weeks, she started talking less to the family members. And then gradually, she confined herself to a room. She started taking less food. And it became so severe that she started urinating in her own room and stopped going out in total. So initially, it seems like she is having a psychiatric problem. But given the sudden onset nature of the problems, we gave this patient an imaging and there was a large brain tumor in that patient that needed an urgent operation. So you can see that sometimes if something is wrong in the body, in our brain, it changes our behavior and the emotion in total, or the way we look into things. Another example, a 17 years old female patient who came to the outdoor. She had an exam after 2 months and she was suffering from anxiety, palpitation, and having less sleep. She is always restless. So it seemed that primarily she is suffering from anxiety disorder, and it is more so because her exam is nearing. But when she underwent her thyroid testing, her thyroid level was high. She was suffering from hyperthyroidism that needed urgent treatment. So these are the examples that if your body is not doing well, your mind or the way you behave, your emotion, these things vary. And it is true from the other side as well. If your psyche or the way you think, your mind is not well, your body may not cooperate. For example, among our friends, our colleagues, we see some people who are overachievers, some people who are always tensed and running after things, who are always thinking about achievement. These people who, in the language of psychiatry, we say are type A personalities, they are supposed to have more cardiac problems. They are supposed to have more hypertensions. And if the stress level is high, we see that they suffer from diabetes. So it is true from both the ways that if your mind or the way you look into life is not okay, then your body will not cooperate. You will suffer from hypertension, diabetes, even thyroid problems, or in case of females, the menstrual irregularities. So even if you are suffering from psychiatric problems, undergo some tests, common tests of blood, or if required, of imaging like CT scan, MRI. And at the same time, when your body is having some problems like hypertension, diabetes, or some other problems, not all, some, then look into your way of life, how you spend time, how you look into your achievements, and are you having enough time to give rest to your body. So this is one important area of mind-body interaction that is very fascinating and interesting, and keep on studying about it. Thank you for listening.